Chapter 1 Homeostasis, Lecture number 9 Disorders of Homeostasis Chapter. The most common urinary tract infections are pyelonephritis, cystitis, and urethritis, and these infections are caused by bacteria called E. coli, and if E. coli bacteria reaches in the kidney, it brings nausea, vomiting, pain, and high fever with cold. Then it is pyelonephritis infection. In cystitis infection, blood in urine is the most important symptom, and increased level of calcium in urine is called as hypercalciuria, and high level of oxalate in urine is called as hyperoxaluria, and the presence of stones in the kidney is called as nephrolithiasis or urolithiasis, and inflammation in kidney due to irritation of kidney stone is called as lithonephritis, and calcium oxalate is the most common type of crystal to form 80% of kidney stone, and some stones are formed by magnesium, ammonium phosphate, steroid, which is in alkaline urine, bacterial activity, and less than 1% stones are formed by amino acid, which is known as cysteine, and cysteine stones are usually formed in childhood, and kidney stone can be treated outside the body by shock wave. This treatment is called as extracorporeal shock wave lithotripsy (ESWL), and if stones are too many large, then laparoscopic pyelolithotomy procedure is used, in which kidneys are cut, and in kidney failure 85% of both kidneys are affected in kidney failure, and there are two types of kidney failure. Number one, acute kidney failure, and other is chronic kidney failure. And acute kidney failure is concerned with suddenly loss of kidney's abilities, and chronic kidney failure is a disease involves in gradual loss of kidney functions, and the hemodialysis is performed by machine regarded as artificial kidney, and small tubes in hemodialysis machine that connect both vein and artery called a fistula. In hemodialysis functions as it is kidney, but in hemodialysis the process reabsorption is not involved, and in hemodialysis is normally performed as 4 hours treatment 3 times in a week, and very expensive process. And peritoneal dialysis prefer 4 to 5 times in a day, and it is less expensive but more complicated with infections, and kidney transplant is done when kidney lost 90% of its abilities. So thank you.